How to better understand autism. Well, that is partly thanks to our guest co-host today. We're actually blessed today to be joined by Dr. Ammar Humaid Albanna. He's a consultant, a child and adolescent psychiatrist. He's also the director of Al Amal Psychiatric Hospital at Emirates Health Services, and he's joining us live in the studio this evening. Doctor, really appreciate your time. Thanks so much indeed for joining us.
It's great to meet you, and thank you for the opportunity.
It's really kind of you to join us for what is a really important topic. I mentioned at the beginning, a lot of us are looking beyond our usual blinkers at the moment, given the uncertain and challenging times we're going through, thinking about others a lot more. And certainly we're talking about autism more. We hear it mentioned more. We are talking openly about it more. Now, is that, in your opinion, a result of better diagnosis and a greater understanding of diagnosis, or just a better understanding of autism as a whole?
Well, it's a great question, and we get asked this question every day clinically by parents, by people who come to see us. And the answer is the latter, actually. So there is increased identification of autism. If we don't have a lot of literature about how autism was diagnosed 50 or 100 years ago, because we didn't have the word autism to label children with neurodevelopmental differences, especially in terms of social communication. If we diagnose autism as difficulty in reciprocal social communication, like I'm talking to you now, I'm looking at you, you're looking at me, you're preparing what you're going to say next based on my facial expression, based on my gesturing. This reciprocity in social communication is the core deficits, rather, in this area is the core of autism spectrum disorder. And we only started to describe this accurately as a medical field in the 50s. So previously it was described something else. And there was recently more awareness about autism. If you look at the numbers, yes, they are concerning. There's a significant increase. Look at 1 in 35 according to the recent CDC American statistics. But if you look at the vast majority of the reasons why there's an uprise of autism, it comes down to increased identification, awareness. People subsidize for interventions, they look for treatments, there's more inclusivity in terms of schools and educational systems. So this accounts for mainly for the increase in the prevalence of autism.
So Dr. Ammar, you mentioned there, obviously we have more research now and we are more aware of what we're trying to recognize. But when it comes to parents being able to recognize autism in their children, what often are the things that they overlook or misinterpret?
Yeah, so it's sometimes a little bit more difficult for parents who have the first child, when the first child has autism or delays, because if it's the second child, they can compare to the first child, they have a reference point. But usually by the age of 1.5 years, you expect the child to speak, to have words. So if there's absolutely no speech by 1.5 years of age, this certainly should trigger at least an assessment or referral. There could be hearing difficulties, but autism is one of the differential diagnoses there. But also things like even before that, even before 1 year of age, when moms talk to their kids and play with their kids, there are usually eye contact there are sounds produced back and forth. There is a reciprocity in terms of the communication. After the age of 1, if you call the child by his name, Ahmed, for example, Ahmed is going to look at you with eye contact, with coordinated eye gaze. So all these skills could be delayed in individuals with autism. So it's mainly delays in verbal and non-verbal communication, as well as sometimes some repetitive behaviors and interests that are quite fixated and difficult to change.
Okay.
So, and Doctor, from a regional perspective, how has awareness and support evolved over the years in the UAE?
I think significantly. So currently there is, alhamdulillah, a lot of awareness. A lot of parents come with their kids very early, like even at 1.5 years or even before this, asking questions, which is very good, because I want to link this to the intervention. Identifying autism earlier is not going to change anything with regards to the child. It's just a label diagnostically that we use to put the child on the right path, because the early years are golden years in terms of intervention. The impact on behavior, on skills, on speech, on relationships, even on cognitive and academic outcomes is quite significant if the intervention happens earlier. This is why we focus on early intervention, and we've come a long way in terms of diagnosing, but we're still not there. still there are a significant proportion of the population that don't come early. And if you ask them, most of them do have concerns actually, even if they come at the age of 6, let's say, or 5. When we come to see them at that age, they tell us that they did have concerns at 1.5 years of age or 2. But sometimes it's the family reassuring them falsely, sometimes even the medical system or pediatricians, and this delay in diagnosis unfortunately has its consequences. So we're trying proactively, such as, for example, within Emirates Health Services or Dubai Health, there's currently screening at 1.5 years, universal screening for autism. And these kinds of proactive steps from the public as well as non-public entities definitely help in terms of picking up the vast majority of cases.
So from 2.5 years, that's when you can start screening?
You can even we usually screen in 1.5 years at 18 months. And most parents would notice the differences. They would say exactly around 1.5 years is when I suspected autism.
You mentioned there the importance of early interpretation, early intervention, early recognition. You're a child and also an adolescent psychiatrist.
Correct.
Talk to me, if you can, about the relationship between the spheres of autism and our understanding of it at the moment, and also mental health as well, especially moving into those formative adolescent years. Do you see a significant change?
Yeah, definitely. It's a very good question. And in fact, what we usually say is the child with autism will eventually become an adolescent and then an adult and then an old person with autism. In fact, recently, a few years back during COVID, one of the people who were first diagnosed with autism died at the age of 99. So people with autism can live a full lifespan. So, and they're allowed to have physical problems and mental health problems as well as everyone else. So what may differ is how they manifest, basically, how depression, for example, presents in someone who has autism could look very different than someone who does not have autism, and an adolescent that doesn't have autism, because of the difficulty in communication. So they would communicate their symptoms differently. So what we advise parents usually is, if they notice any change, because they know their kids very well, so if there's a sudden change or significant change in terms of their ability to take care of their day-to-day activities, in terms of their desire to go to school or to the center, in terms of any new complaints, then the advice is to go and see a specialist and to take it from there, basically, whether it's physical reasons or mental health reasons, including depression, anxiety, bipolar, all kinds of different mental disorders that could be experienced by an individual with autism.